At the American Dermatology Convention, not only new and fancy technologies are presented, also this good old radiotherapy for the treatment of skin cancer entered the spotlight. Thanks to this man, Professor Cognetta, a man with a mission. He's trying to give this therapy a second life.
Before Mohs surgery and before anti-inflammatory drugs, radiation was a very important armamentarium for dermatologists. It was certainly one of the #1 treatments for skin cancer during the 20s, 30s, 40s, and 50s. But once dermatology shifted to a surgical field and once we got anti-inflammatory drugs, the use of this modality has decreased.
And that's a pity, because there's still a place for this radiotherapy, especially for older and fragile patients with non-melanoma skin cancer.
We look at the tumor, we look at the patient, we look at the patient's comorbidities, their medical problems, if they're on blood thinners, if they have heart failure, if they're old and feeble. Then we look at the tumor. If the tumor is not aggressive and it's amenable to superficial X-ray, and the patient's over age 70, we at least offer them this modality. And of all the patients referred to us for Mohs surgery or skin cancer, which are a considerable number, about 5% are eligible, appropriate, and elect to use superficial X-ray. So we offer that to them. We did a study, 1,700 cases over a 10-year period. We had a 95% cure rate for basal cell and about a 94.5% for squamous cell. You know, that's still an A in most people's book. Mohs is about a 98 or a 99%. But when you give patients a choice, you'd be surprised. You know, sometimes they don't want the 98, 99% if it means 3 or 4 hours of surgery and pain and discomfort. Certain parts of the body do better with radiation than with Mohs surgery. For example, the rim of the nose, especially people with thick sebaceous noses, virtually you can, if you fractionate it correctly over time, you can leave almost no scar. The scars with Mohs surgery improve over time in general, especially the older patients we see. The scars with radiation do get worse over time, and those are called the late sequelae of radiation. That can be minimized by fractionating radiation over 10, 15, 20, or 25 to 30 fractions.
The major burdens for the resurrection of radiotherapy are often practical. Difficulties with reimbursement, safety, lack of education, and until recently, the fact that you couldn't buy any new machines.
The machines that I started using were really antiquated machines. The new machines are much more reliable, they're solid state, you know the dose, you can dial in the dose and it gives you a cumulative dose every morning. The dose is checked by a little ionometer, and so you can keep the safety up on these machines. I did it from the time I was a resident back in 1984, but I'm the last of that breed, okay? Now it's up to me and others like me to try to keep this modality alive, because if we lose it to electron beam, or dermatologists are the best at deciding what the best treatment is for the skin, how deep the tumor is, what type of tumor it is, what the borders of the tumor are, and for sitting down with the tumor. We are, in a sense, the gatekeeper for skin cancers.